All right, guys, I visited a trusted doctor today. Greetings, doctor.
Hello, guys. I'm Dr. Folemu, with the trusted doctor.
So, what is going on?
Okay, so we are having this 26-year-old woman.
Yeah.
That is gravida 1 means it's her first pregnancy, and her gestational age is 41 weeks 6 days.
Wow.
And her estimated weight is 4.2. The baby is 4.2. She has actually, labor has begun, and she has reached full dilatation, but due to the size of the baby, we cannot really have the baby pass through because the baby is too big. So we have gone in for the option of the CS.
Okay.
And I think that will be the best for both the mother and the baby.
So, sorry, doctor.
Yeah.
What is CS?
Okay, a cesarean section, or CS, is a surgical procedure where we cut through the abdomen and through the woman's womb to extract and remove a baby.
Okay.
So it's just cutting into the womb and extracting the baby. It's a method of delivery.
All right. So what are the possible complications, doctor?
Okay, complications. There are several complications. There are short-term complications. There are long-term complications. There are complications that are related to anesthesia. But without saying much, one of the common complications that we can have in this case is we have headache. After surgery, since the woman is taking spinal anesthesia, she can have serious headache. Okay, and we have the most common complications that we have are complications of bleeding. In the process, maybe an artery can be touched and she bleeds excessively.
Okay.
Among which there are so many others. She can aspirate. Yeah, she can vomit through the process. Maybe if the intestines are a little bit touched, and then she can have some nausea, vomiting, and it aspirates and goes through the airway.
Okay.
Yeah. So those are just some of the minor complications, but the major thing is bleeding. It's postpartum hemorrhage. That's what we try to avoid.
All right. So.
Yeah.
Bleeding, if there is too much bleeding, how do you manage it?
Okay, it depends on the quantity of bleeding and where the bleeding is.
Okay.
With minor bleeds, what you just need to obliterate the vein. That is to block or to stop the bleeding. If a blood vessel is bleeding, we have to suture and close that blood vessel and prevent it from bleeding more. Sometimes the bleeding can be from what we call the postpartum hemorrhage. It can be because of the uterine tone. If the uterus is not contracting, and it continues like that. Sometimes we need to go for a hysterectomy. In very serious cases, you can have a total removal of the womb in order to save the mother. Wow. If the uterus is not contracting and everything is done and nothing happens, yeah, we need to do a hysterectomy sometimes.
It means bleeding.
But not very often is that done. It's rare.
Yeah. It means bleeding is a serious case.
Yeah, it's one of the serious complications that we can have during the CS or after.
Okay. Yeah. So after the CS, how long will it take for this woman to walk?
Okay, I think in approximately 6 to 8 hours, the anesthesia would have cleared out, and she can manage and have some few steps around from 6 to 8 hours.
Within this period of time, is she supposed to talk?
She just needs to lie down on the bed without raising the neck. Yeah, but she can talk. There's no problem with talking, but not like making noise. Yeah, but she can talk without any problem.
Okay.
Yeah.
Okay. How long is she supposed to stay before eating?
Okay, she can start taking some minor sips from 6 to 8 hours. Okay, just take some sips.
Minor sips like is it water?
You can take water. Yeah, you can get water. You can get Lipton, some tea. Yeah, something liquid.
So approximately, how long is this CS going to take place?
Everything being equal in 30 minutes maximum, we should be out of the theater.
Okay.
Yeah.
All right, doctor. Thank you very much.
You're welcome.